infertility has become so rampant in the world that approximately 10% of the women in the United States have problem getting pregnant. Well, you guessed it. This is the topic we're going to talk about today, infertility and how can you help. So joining me is Dr. Ashish Paul from UK, and she will be talking about how help. And that's the topic, infertility, guys, infertility. And I remember, well, there you are, Vaidya Ashish. Welcome to the show.
Thank you. Can you hear me, see me well? I think
yes.
My forehead is a bit cut.
You look great. Everything is perfect. Don't worry about it. Well, everyone, we are talking about infertility and why it has become such an issue. I remember my grandmother, my maternal grandmother had 5 kids and paternal grandmother had 9 kids. And now you see women having even 1 kid. That is the topic. We have Vaidya Ashish Paul. She is a fertility expert from UK. Vaidya Ashish Paul, welcome and tell us a little bit about yourself. What led you to becoming a fertility expert? And then we'll come back and talk about how Ayurveda can help.
Warm Ayurveda greetings to everybody and to you, Amita. Lovely to be here and thank you for having me. And you asked about, my interest in this. I have IVF twins myself, a boy and a girl. They are 12 years old. And although in my case, this was first hit having successful IVF, which is very small percentage of people that have that. That's where I started realizing. I used to take them to Twins and Triplet Club, and I started meeting more women who have had 4, 5, 6 cycles, but they never mentioned it. It was a hush-hush thing. You learn from certain things, okay, they have had more than one IVF cycle. Because in my case, I thought, I'm going to have one IVF cycle. If this is my destiny, this is fine, but I'm going to use Ayurveda, everything natural that I have. Because we know IVF is very invasive, it's intensive protocol. So that's where I started meeting these women. And I started getting more and more. My first question to myself was, why are we not doing anything natural? Why is it that women and men, of course, they have to go through all this long protocol of steroids and steroids? There is so much in Ayurveda that we can do, right? So that was my first question. So that's where it started. And also as an internee, when I was doing my Ayurvedic degree, I also have done 5 years of gynae and ops. So I used to work there also when I was doing my degree and afterwards. So gynae and obs is kind of my passion, but I've come round circle because I know I can't work as a gynecologist here in UK. So I've come round circle, helping couples, supporting them, going through this journey. And as you have mentioned, of course, infertility is on the rise. I prefer not to use the term infertility because it has real negative connotation. It really puts you in that dark hole bracket where everything seems, okay, there's no other option. According to me, nobody in the world can tell you whether you're fertile or infertile. Of course, in very rare cases where you do not have absolutely no sperms or no uterus, only then, and which is very rare. Otherwise, you never know when somebody is going to get pregnant. So I think doctors do a great disservice to people when they tell them you may never be able to have kids. How can they tell? So this is how I have come round circle, helping and supporting couples, and mainly women, of course.
No, I think that's actually a very powerful story. You yourself have experienced the the agony, I should say, that of going through an IVF. Maybe it wasn't so agonizing for you because you got lucky first time, but look, to all the other women out there, they must have gone through multiple IVF. So now it brings to Ayurveda. So you and an Ayurvedic doctor. So educate all the women and the guys. I see a lot of guys joining, and welcome. How Ayurveda can help. What does Ayurveda has this magic wand that how does it help women and men, or even for that matter couples, to conceive a child, a baby?
Yeah. I mean, fertility journey overall is now kind of almost synonymous with women. That one reason being that even when it is a man's issue or sperm's issue, even then, IVF or all those techniques, mainly women have to take those medications. So that's why it's more synonymous with women. But that's not the case. 50% of fertility issues lie with men. And also, exactly. And also to have a good progeny, to have good embryo, you need good genetic material from both the parents, from father and from mother. So it's not to say that, okay, as long as you have good quality egg, the sperm quality doesn't matter. It matters equally because by studies, it is shown that when sperm is of low quality, there are more chances of miscarriage. So that is... and men's fertility, which nobody talks about, and I feel for men because they really feel, left out, is decreasing. It has decreased in the last 50 years, 50%, and it is still decreasing. And the sexual issues that men have, and I've seen it more in certain cultures. I know from Indian, Pakistani background, men who have erectile dysfunction, other sexual, issues, it's quite a lot. And again, they don't talk about it. And it all contributes to fertility.
Yeah.
So what can Ayurveda do? And my question is, what can Ayurveda not do?
Wow. That's amazing. That's amazing. Yeah.
Yeah. So that's how passionate I am. That's how much I know that it helps, because I've seen it case after case with women and men where I'm helping. Even little thing, So I'll give you an example. With one of my patients who had, the couple had one child already, which was IVF kid. Second time, they had 2 or 3 IVFs, which didn't work. Then they came to me, and the whole journey with me also took a year and a half. In between, she had another IVF cycle. And this time, when she was working with me with Ayurvedic medicine, not necessarily with me, but with natural medicine, know. And this is somebody who, even after giving really strong steroids, giving so much initiation, could only collect 3 or 4 eggs. And with Ayurveda, with all the protocol that I was using, they were able to collect 8 or 9 eggs. And even the consultant was like, what have you been doing? And she said, you have sent me to Dr. Ashish. That's all I am doing differently, right? So it shows that all these protocols, slowly and holistically, that we are working on patients that I am using, is working for them. And more number of eggs means no more chances of having a pregnancy. So that's how critical it is to increase the number of eggs. So that's my education. You might have seen my posts everywhere on my platform as well, is that doesn't matter what you're doing, doesn't matter where you start your journey from, and doesn't matter what allopathic medication you're using, use something natural with it. Use Ayurvedic medicine, use the herbs, use the therapies if they're available to you. If you have a therapist close by, use it. So my education and my message is, use it. Even if little thing you can use that.
Absolutely. And Ayurveda has such an amazing toolbox. I'm using an English language here to kind of people, when I say toolbox, it has like an assortment of different curated therapies, like from panchakarma to herbs to medication, right? So and yoga and pranayama. So do you use the entire gamut or the assortment that's available to you from Ayurvedic perspective, or do you kind of pick and choose what is applicable for the specifically for the fertility issues?
So especially for fertility, for men and women equally. So I personally like to use treat both men and women if I can. Unless it has gone too far into IVF, where then we don't need to treat or manage men's issues. But what do I use and what I think people can use, and that's why I call my method is more to do with rejuvenation. So it's rejuvenating your holistic health, rejuvenating your eggs and sperms, rejuvenating your tissue state, rejuvenating your mind, all of that. Overall, I am working on all aspects of you. So if you want me to name what I use with them, I use Ayurveda, Ayurvedic herbs, Ayurvedic therapies that include Abhyanga, Shirodhara, Panchkarma, Basti. I'm trained in NLP, which is a neuro-linguistic programming. So I'm a master practitioner of NLP. I use NLP techniques to change the mindset, to work with the mind. Then pranayama, of course, pranayama is the best to improve what we call antioxidant. It is the greatest antioxidant that we can have. So I use that. I use Western herbs as well because I'm a trained herbalist. So when I don't find Ayurvedic herbs, I use Western herbs. And all of these therapies together, combined, that's how I work with them. And that's why my method is very specific, very elaborate, working on every aspect of them.
Yeah. No, it makes sense. And somebody made a comment about Garbh Sanskar. My knowledge of Garbh Sanskar is after you get pregnant. Correct me if I'm wrong.
Garbh Sanskar, technically it starts from the moment you start to think about having a family.
Oh, it does it? Okay. Yeah. So that's the whole journey is that.
It starts from the moment you want to become parents. And actually Ayurveda recommends that you should take the blessings, you do the pujas, you do the havan, you get in the right mindset, then you do the panchkarma, then you are really cleansed and detoxed, then you go for pregnancy or conception. So that's where Garbh Sanskar starts from. So actually Ayurveda is great in that because and Ayurveda is a great psychosomatic paradigm because it talks about mind at every step. So even when you're thinking about having a baby, you have to think from that perspective. You have to first correct yourself as a parent, and then you can think about having a good, what we say, progeny in medical terms. But yes, Garbh Sanskar starts from that point. It goes all the way through 9 months and until the baby is born.
Got it. So it's basically Ayurveda is talking about cleansing inside out, right? But not only with the body, but also with your mind, and spirit and thoughts. And that's what, it talks about that. And that's what you're referring to, a completely detox, so to speak, inside out before you're even thinking of conception. And once you do that, then you kind of are relaxed, right? To your point?
Absolutely. And I think Ayurveda is a great model of functional medicine. Now everybody is talking about functional medicine.
Yes.
For me, Ayurveda is the oldest functional medicine because it talks about the subjective nature of human beings. Every story is different, especially to do with fertility. It has got so many different factors. Plus, it's a joint effort between two people. So that's where it becomes even more critical. It's not only about controlling my health. It's about also looking at other person and the environment around us, right? So it is all of it together and the mind, which is the biggest driver for everything. And I've seen this with patients. This has to be right. If it's not correct here, one of the questions I ask my clients is when they come for first consultation, why do you want to have a child? It's critical to how you set this path, how this journey is set for you, right?
Yeah.
Are you having a baby because next door neighbor has a baby and you want to have kids play together? Is that your reason? Or do you have a deeper reason? Do you have a calling to have a child? Because Amita, I'm sure you know this, kids are hard work. It's it takes a lot of energy and effort to raise them, to bring them into life first, and then also to be with them all the way. So it's important for us to realize what are our reasons to go into this journey. And also I personally consider the idea of spirit. Many people only work at the mind level or the psyche level. I include the idea of spirit. So spiritually, where you are in your journey, how does this fit spiritually, right? Having a child. And children don't come here for us. They are their own beings. We are just a channel for them to come here so that we don't become possessive when they are here afterwards. So it has to start from inside out. The whole message of Ayurveda is it starts from within and then you are doing things from outside as well.
Absolutely. And I do want to add, it's really funny. I watched one of the Bollywood movies and it was on sperm donors, right? And they were talking about the stress, all of us live in metros, not all of us, majority of us, I would say that.
Yeah.
And people who are living in metros have so much stress as opposed to this movie was based in India. And they were talking about how people who are living in villages don't have stress and they're able to produce so many kids as opposed to someone who's living in metros is going to a sperm donor bank and taking the sperm, looking for sperm donor bank and finding a sperm. So that's what, and they made it into a funny movie, which was, I think, was hilarious the way they portrayed it. But to your point, the lifestyle, right, that you're talking about, that impacts so much, on your sperm quality. If you're a man, not that I'm capable of talking about it, but do you want to add something on this, on the
Absolutely, yes.
Yeah.
Lifestyle is, how we are living a life, how we are living every single day. And Ayurveda recommends dincharya. Dincharya means day, and charya means routine. So what is your daily routine? So there is an ideal way to live your life according to your doshas, according to your constitution. So how do you live that day? And stress has become this buzzword, but stress has lots of variations, and everybody reacts to stress differently as well. One person can eat and overeat when they're stressed. One person eats nothing when they're stressed. So our bodies react differently. That's why we have to know how stress is affecting us. Most of the people don't realize they are under stress. Okay.
Yeah.
That's also, it's when we realize, okay, actually this is how I react when I am stressed out. And how, and of course, stress at the level of the cells. So first stress, it is at the mental level, and then it trickles down into our bodies, into our cells, into the mitochondria, which is the reason for aging of eggs and sperms. Also, one of the things that I see, because I see more women and men over 35 trying to conceive. So, it is, medically, as we know, it is more in the later ages that they consider. So especially for women, they have this window, as they say, whether we like it or not, the fertility starts to reduce. And for certain ethnicities, it reduces even furthermore because our genetic pool is not healthy enough or not strong enough. So we have to be careful. We have to know of our lifestyle. For example, I'll give you an example. Many of us, we work with laptops in our laps, right? Now people are standing up and getting all these platforms and doing this. But one reason for sperm low quality is if you have laptop, which is very warm, sitting on your lap for men.
Oh. But to all the guys, be careful.
Yeah. So it's if this is something that 5 out of 7 days you're doing this, but you're not aware of it, and all that little things make the difference. Eventually, all these add up and have a bigger impact. So yes, lifestyle is crucial for us to, and I talk about lifestyle rejuvenation as well. So how can you, what are the little things you can change? It's no good for me telling you ideally you should get up at 5 o'clock. If this is not your lifestyle, it has to fit in, and you have to be comfortable to fit it in so that it doesn't feel a chore. I don't want to stress you further by giving you another, thing to do. So yeah.
All right. Well, I think these are just small sessions. These are educational sessions. And this particular one, we wanted to talk about fertility and tell our viewers that there is hope. There is a natural way that you can, if you wanted to start a family, there is hope. Someone asked a question about how to control stress. It's a completely different topic. We cannot cover it right now. We'll cover it in our upcoming sessions. But I do want people to kind of understand that there is hope with the natural medicines such as Ayurveda, and that's the takeaway message today. Any final comments you want to add before we wrap up, Dr. Ashish?
Yes, I hear this so many times from my patients and clients when they meet me and they've just passed that window and they've stopped trying, 50 plus, 55 plus, and they say, oh, I wish I had met you earlier. Or there's so many other men and women, they say, oh, we wish we could have started early, or we wish that we have met you earlier,
Yeah.
So it is, and that's why it's important for us to talk about it, because doctors are not trained in herbs. So they are never going to advise you. They're not trained in herbs. They're not trained in diet or nutrition. They are not going to tell you what to do, and they don't, which is actually really sad. But it is to realize that doesn't matter where you are in your journey, you can use something natural. You can always use natural therapies. If consultants, your doctor doesn't allow internal herbs to take, you can do therapy work, you can do natural massages, you can take natural supplements. So there are so many ways to do this without thinking, oh, this is the dead end now, I can't do anything. Only because my gynecologist has said, you know, this is the only way. So do your research, look out for natural medicine practitioners who are, you know, doing something, and get that support. Not self-prescribe. Don't go to the counters and just buy something, you know. And I've seen ashwagandha being prescribed for all sorts of different reasons. So please don't do that. Go to a practitioner who is trained. And these days everything is online. I mean, you could be sitting in anywhere in the world and still consult me if you wish, or anybody else. But go and see a practitioner and find out what is your constitution, how does your body react to herbs, and whether it's suitable for you, and then take them. And of course, you can always tell your doctors as well, you know, that you are taking this. And I believe totally in evidence-based practice. So it is not a mumbo jumbo that somebody has just given you some kind of herb, you know, you don't know the name of. I give names of all the herbs that I use. I give the dosage. I send people all the background studies that have been done on that subject, whatever I can find. So, you know, so that we are also informing people.
Absolutely.
They are not, because herbs is it's a vast area. And then people think, I don't know anything about how to use this herb. And doctor or the herbalist has just given me something packed up and it doesn't have a name on it. That's not a good practice. So go to a practitioner who's very open and can take you through all the medications that they're doing. But do something natural, guys. Do something natural. That's my main message.
Thank you. Thank you. And you know, I do want to say that we are coming up with a lot of programs, wellness-based programs in March timeframe. We are launching different programs. And this is one of the programs we will be launching soon with Dr. Ashish, you know, just and where you will be able to have access to her. So with that, you know, I'd like to wrap up this session. Thank you so much, people who joined us. Thank you very much for joining us, and help us share these sessions. This is a natural way of living. That's what we are advocating every single day. With that, I'd like to thank you everyone for joining us. Thank you, Dr. Ashish, for joining us from UK. Signing off now. This is Amita from Nourish Talk. Bye now.
Bye-bye.